Hi everybody, my name is Terri Widdick. I'm a physical therapist with CORA Physical Therapy in Jacksonville, Florida. In today's episode, I'm going to be talking to you about pain, teaching you a little bit about what pain is, how people respond differently to pain, and then at the end I'm going to give you a few tips and tricks of how to treat your pain at home. So first and foremost, we're going to start with understanding what pain is. So I'm going to switch here to a PowerPoint. Bear with me a second. Okay, so let's say you step on a nail, right? Do you want to know that you stepped on a nail? Of course you do. So you have the central nervous system. Everybody has a central nervous system made up of 400 individual nerves that are all interconnected like highways, okay? So this totals about 45 miles worth of nerves. And what happens is, since they're all interconnected, movements at the wrist are going to affect the shoulder, movements at the neck are going to affect the back. Again, all interconnected. So let's talk normally. Normally, there's a level of excitement in the nervous system that says that you're alive. That's completely normal. So normal excitement level, and this is before pain. So you have lots of room for activities. That means you can move around, you can run, you can play soccer, you can do whatever, even just getting out of bed sometimes, and it's not going to affect it, right? It's just trucking right along here and nothing's really happening. So what happens when you step on that nail? Well, the nervous system senses that, and it's going to send a message to the brain. So it's the normal excitement level, you step on the nail, and it sends that message to the brain. So it sets off that alarm that something is going on at the foot, and the brain needs to tell you to respond to get the foot off of the nail. So there's the firing level. So it shoots up, it sets the alarm off, and now we're at a heightened sensitive nervous system, right? Because now it senses that nail, sends a signal of danger to the brain, and the brain has to respond. So the brain responds by producing pain. So you get the nail out, you wrap the foot up. Does pain go away immediately? No. It takes a little bit. So maybe you have to walk on crutches for a few days, or take some anti-inflammatories, or ice the foot. But over time, it's going to go down. This may take hours, this may take days, it may take weeks. And it goes back down to where you're that normal excited level of the nervous system. So after pain, so this is after you step on the nail. So this is the normal excited level of the nervous system. Now this is the heightened extra sensitive. So it's shot up, right? And now it goes back down. So normally we talked about it going back down to the normal excited level. However, 1 in 4 people, the nervous system stays extra sensitive. Okay? So this is after pain. Normally it goes back down. 1 in 4 people, it actually stays heightened. So now there's little room for activities before it sets that alarm off again. So you move the body a little bit, you move the foot a little bit, boom, it sets the brain off, says there's danger. The brain produces pain, and it's a vicious cycle here, okay? So we talked about before pain, lots of room for activities. You can move around. It's not setting that alarm off in the brain. However, after pain is produced, we're now not at that normal excited level. Our nervous system is now at a heightened, extra sensitive level. So again, there's little. It doesn't take much to set that alarm off in the brain, telling that there's danger, and the brain produces pain. So why 1 in 4 people does that sensitive or that nervous system stay extra sensitive? Well, it's very complicated. There's a lot going on, and it kind of depends on what was going on around the time that you stepped on that nail or had that injury. There's a lot of different things. So your knowledge of kind of what's going on. If you don't really understand what's going on with your back or what's going on with your foot, There's fear and anxiety that starts to happen. The pain goes on. Once it goes beyond 3 months, it's considered chronic or persistent pain. With that maybe comes job issues. You lose your job. You have to call out because you can't even get up out of bed. You go to 5 doctors and everybody's telling you different things about what your pain is. There's family concerns, money concerns, and then failed treatments. Again, you go to 5 doctors, you try injections, you try anti-inflammatories, and nothing seems to be working. So let's talk about this. So the lion in the room. So say you're sitting in your living room and you're watching TV, watching Netflix, watching, what's the show? Tiger King, something like that. And a lion bursts into your room. This may actually happen to him. Anyways, a lion bursts into your room. Immediately, your system is going to be heightened. You're going to go into that fight or flight response. Everybody has kind of felt that at one time in their life, and you know that your blood pressure immediately goes up, and you kind of get that, your heart starts to beat faster. So what happens when that is constantly happening? So that's somebody that has pain it's constantly happening, and you're constantly in that fight or flight response. And what happens is it not only affects your blood pressure, it starts to affect other systems in your body. So normally you have a balance in your body. So these are all off balance. So this represents when that lion bursts into the room. Because when the lion bursts into the room, you're not worried about what's coming next on the TV. You're worried about getting away from the lion. So obviously, in response to that, which is good, that's what saves lives sometimes, is your response to the lion in the room. So stuff starts to become unbalanced. Instead of watching the TV and knowing what's on TV, now you're worried about the lion. So what happens is when these systems stay out of whack for long periods of time, they start to affect everything. So say you have pain in your foot from stepping on the nail, and that pain doesn't go away. 3 months later, now you can't sleep. You're starting to get depressed. You have appetite changes, things like that. So let's talk a little bit about the lion in the room. What is the lion in the room? What does he represent? He represents pain, failed treatment, stress, different diagnoses, everything that we talked about before, job issues, losing your job, money concerns. Some people, when you have this for so long, you can't go to work, you don't get paid. So this is the lion in the room. So somebody that has persistent or chronic pain is constantly being, the lion is always in the room with them. They're constantly worrying about these things. And what happens is, like we talked about, those systems are balanced on a normal basis. However, when the lion is in the room, they become unbalanced. And when those systems become unbalanced for a long period of time, you start to get changes to other things. You may notice that you have memory issues. Some people will start to develop back pain, and then 6 months later, now they feel like they have memory issues. They can't remember what they went to the grocery store for. They can't concentrate. They can't sleep. They start to have mood swings, appetite changes. Depression is a big thing that comes along with chronic pain. And it's just a vicious cycle sometimes that you can't get out of, because going back to that sensitive nervous system, there's not much room for you to move around. So what happens is you move, it sends a signal to your brain that you have pain, or that you have danger, and then the brain produces pain, and it's just a vicious cycle response. So sometimes it's not due to tissue damage that you have persistent pain. It's actually due to that heightened sensitivity in the nervous system. After some time, the tissues are going to heal. They've now known that herniated disc can actually reabsorb. I think that everybody's heard the fact that they can do an MRI on 100 people, and about 40% of them have herniated disc with no symptoms. So everybody feels like that MRI or that herniated disc is what's causing their pain, and that's not usually the case. There's a certain point where those tissues heal and stuff becomes settled. But because the nervous system is heightened, again, those little movements are going to set that alarm off and continuously set that alarm off to the brain that there's danger. So there is a good thing that there is something we can do about it. So let's talk a little bit about that. So this is the normal excited level. Remember, when you step on the nail, it shoots up here, and normally it goes down, right? So there's a lot of things that play into this and affect this going back down the nervous system, becoming back to normal excited levels and staying out of that extra sensitive where 1 in 4 people actually stay, okay? So what can we do? Well, now you know a little bit about pain and kind of the background and what happens with it, right? So you know knowledge. It's best to know about kind of what's going on with your back. So, you know, ask questions to the doctor, this and that. And again, remember that pain can happen without injury. Have you ever woken up with a bruise on your leg and you didn't know where it came from? You know, that's a prime example of there was no injury that you can recall. And then there can be an injury with no pain. You know, you see some of these football players that break their leg and they end up playing the rest of the game. Any of us would be crippled on the side of the football field. So there's just different responses to pain. So knowing about pain and knowing how it affects your body and knowing that even though you may not have had an injury, but you still have pain, pain is real. Everybody feels it differently. So knowledge is power in this case, okay? Aerobic exercise. So there's many studies that have shown that aerobic exercise, in addition to knowledge and knowing about your pain, is actually going to decrease it. So I want to talk about a few things. Manual therapy. So of course, coming to physical therapy and getting hands-on stuff is great. That can also help. Relaxation and meditation. Okay, so these are something that not a lot of us get to do nowadays, especially the ones with the kids at home and homeschooling and, you know, dealing with the stress of what's going on in our world right now. It's very important to kind of find your space and find time where you can just reflect and kind of in a quiet area. I tell people that journaling is a great way to do this. The other thing I wanted to talk about is pacing and graded exposure, okay? So again, we talked about relaxation and meditation. There's lots of apps now through that you can get on your phone, and it literally walks you through meditating. They're great. You can actually get it just 5 minutes, or you can go all the way up to, I'm sure you can go up to an hour, but just finding time, even 5 minutes throughout the day, just to meditate and just to kind of relax and find kind of your happy place. You know, the weather's getting nicer, at least here in Jacksonville, so you can kind of go outside and find a place to relax. Like I mentioned before, journaling. I tell my patients all the time that just journaling, just writing down your thoughts for the day, what you're grateful for, and nobody's going to read it but you. You can even take the paper and throw it out if you want. But journaling is a great way to kind of get your thoughts out. And sometimes rereading it helps you kind of figure out what's going on in your brain and what you're thinking about and you know, the stress that you're dealing with. That's a big thing. Remember that the stress of everything is going to affect your pain. And if you stay at a heightened sensitivity in the nervous system and you're stressed and it's going to stay there. So addressing the tissue damage, if there is any, is not enough. You have to address everything else that's going on and all the environmental aspects that are also affecting your pain. So that's where these come in. So the relaxation, the meditation, the journaling, okay? Balanced nutrition. So there's all these fab diets out there, low carb, this, that. Just a balanced diet and not overeating anything. So you can have ice cream, but don't overindulge, you know? Make sure that your food is high fruits, vegetables, you know, and just kind of stay balanced. Next week, I'm going to be doing another episode on here about nutrition. Physical therapists are not only, you know, we don't only address the biomechanics and the physical aspect, but we can also give advice on nutrition, and just kind of, because treating the body and the muscles, but if you don't treat the inside and you don't feed the muscles the right thing, it doesn't all come together. So sleep hygiene. Sleep hygiene is super important. There's a few things that I learned about sleep, that, you know, like stopping the coffee in the morning after your morning coffee, not drinking it in the afternoon or late in the day, not letting kids or dogs sleep in your bed. So having kind of enough room to move around in bed is super important, which I'm guilty of letting my dog sleep in my bed. What else? So turning your TV off. So turning your, you know, not playing on your phone in bed, not having your TV on when you're in bed. I don't even have a TV in my room. I really believe in the, you know, the bedroom is for sleeping. You shouldn't be laying in there watching TV until 2 in the morning because your brain is going to be constantly working. So those are just a few tricks about sleeping. There's plenty more to learn. Social interaction. So this is kind of hard with everything that's going on. However, we can still connect to family via video, Zoom, FaceTime, just, you know, calling somebody on the phone. And even if it's not you, maybe you have a family member who hasn't left their house in 8 weeks, you know, give them a call on the phone and FaceTime just so you can have that interaction and maybe, you know, help them out. And then humor, you know, getting a good laugh it always feels good. And I always ask people that have pain that when you're doing something you love, when you're laughing, you know, do you feel your pain? And they'll usually say, no, I don't. And it's because the brain is thinking about something else. So finding ways to relax, finding ways to laugh, finding ways to interact with people. And lastly, we talked about the aerobic exercise. Okay, so my patients always, you know, they start to feel better and then they come in the next day and they're like, oh, this is not working. I am back to where I started. And as I start to ask them questions, I realized that they were starting to feel better. And what happened is they went out and they tried to walk 4 miles yesterday and do a workout video online that they found. And so that's where graded exposure comes in, and pacing, if you've ever heard that. So when you start to feel better, when that nervous system starts to go back down to normal, it's very important that you don't overdo it. So making goals of, say you can't clean your house. Well, don't feel better and then go clean your entire house. Make it a goal to do one room one day, one room the next day, and kind of so on and so forth. So you're not going from 0 to 100. That's what I find most of my patients are guilty of, is when they start to feel better, they go from 0 to 100 and then they take 2 steps back. So when you start to feel better, I educate my patients to kind of make small goals and get there. So if you want to walk a mile, you know, walk 10 minutes or walk 15 minutes and then see how you feel the next day and then kind of add on to that. So don't do everything all at one time. So that's that. We're going to exit out of here. All right. So I hope that you guys enjoyed this. Like I said, we're doing this every Monday, Wednesday, Friday at 12 o'clock. We're offering you guys some advice, some tips, anything from low back pain to neck pain. I did one a few weeks ago on neck pain and how to address that. We had ergonomics and how to set that up. Let's see what else. So next week we're doing the nutrition one. I know that everybody has been guilty of sitting at home and eating and maybe gaining some weight. So as we all start to become active again, hopefully you guys can tune in next Friday and take some advice on the nutrition aspect of it. But in the meantime, like I said, Monday, Wednesday, and Friday, we're offering these little episodes at 12 o'clock. And lastly, what I wanted to say is that all of our clinics are open. We are abiding by the CDC guidelines with taking patients' temperature. We have therapists that are wiping down stuff in between. We wear masks, we wear gloves. We all ask all patients to wear masks. We have a questionnaire for you guys that if anybody's exposed, gone out of the country, those kind of things that we ask you not to come in. And with that being said, we also offer telehealth, which is super cool. I think I talked about it a few weeks ago, but I've actually transitioned to being a telehealth therapist full time, and it's been super interesting for me, trying to be creative and find ways for people to reproduce what they were doing in the clinic at home, with or without exercise equipment. So please check that out. If you have pain or if you have questions, you can always call us and set up an injury screen. And we can do that via telehealth through just like this, okay? So if you have any questions, please list them below. And I actually lastly want to thank Adrian Lowe. He is the professor at the course that we took on pain, and I've learned so much from him, and that is where I got a lot of the pictures and stuff from. So thank you. And I hope everybody has a great weekend. Thank you.